Hi everyone, welcome to Motivations. I'm Janet Miranda, your host. More and more of us have been relying upon the historical nutritional paradigm that says, in order to get fit and lose fat, we have to either work out more or eat less. Well, many new programs have evolved since, including one that is currently trending in the land of the wellness world, which is our next topic of discussion called intermittent fasting. All cultures all over the world have used fasting in some way or another throughout time. Fasting is not the same as starvation. It is simply a controlled voluntary abstinence of food. Intermittent fasting is a diet strategy that involves alternating periods of eating and extending fasting. It is also said to provide hormonal and cellular benefits like lowering our cholesterol, improving heart health, and some studies are examining the connection between intermittent fasting and improving cognitive function and protecting against conditions such as dementia and Alzheimer's disease. HSPH Harvard shared that a systematic review of 40 studies found that intermittent fasting was effective for weight loss with a typical weight loss of 7 to 11 pounds over a 10-day period. They say that with intermittent fasting, not only did these guys lose fat, but it also prevented them from losing muscle mass. Now, there are several different eating patterns of intermittent fasting, and we'll get into all of that, as well as some of the great effects from including disease prevention and combating obesity. Our next guest is going to chat about some of these patterns and give us a at-home insight about this topic. So let's go ahead and introduce our guest now. Our next guest is a board-certified physician in Maternal-Fetal Medicine, Obstetrics and Gynecology. She's also a diplomat of the American Board of Obesity Medicine. She began her interest in incorporating fasting as a technique to come out of her own personal struggle with obesity. Not only is she helping with the world with the theory of changing her eating patterns, but she's personally reversed her own metabolic syndrome, which includes hypertension and glucose intolerance. She's also lost over 50 pounds by incorporating intermittent fasting into her own life. She believes intermittent fasting should be a standard for disease prevention treatment and offers coaching for people who are looking for more guidance. Let's give a warm welcome to the fasting doctor, Dr. Cecily Clark-Ganheart. Welcome to the show. Hey guys, it's Janet Miranda with Motivations TV. Today we're bringing on an exciting guest to talk about intermittent fasting. Dr. Cecily Ann, welcome to Motivations. How are you today?
I'm doing well. Thank you for having me. I'm excited to be here.
Well, go ahead and start off by sharing the journey that brought you to discovering intermittent fasting. How did you get here?
Yeah, so it's very interesting. In medical school, we didn't really get much training about health and wellness. And so I kind of found this after my formal medical training. So I tried it on myself first. I was my first patient, if you will, with intermittent fasting. After the birth of my second son, I was at my highest adult weight. I was 264 pounds. And I realized that, if I kept going in that direction, that all of the health-related complications that can come with being either overweight or being affected with obesity, I was at risk for. You may have heard of something called metabolic syndrome, which it's a constellation of medical conditions that all have kind of insulin resistance at its core. And I definitely met the criteria for that. I was pre-diabetic, and I had hypertension and abdominal obesity. And so if I kept going down that path, I was going to either end up probably on insulin. I was already taking antihypertensives, and I was only 28 at the time. And so I really wanted to change my life. And it's not that I hadn't tried before, I just hadn't found anything that was successful. You know, I tried calorie counting in the past. I tried eat less and working out more, you know, and at that point, I tried everything, and I really didn't feel like it was due to a lack of willpower. I just hadn't found what worked for me. And so when I began intermittent fasting and actually saw the weight coming off, and not only did the weight come off, but it stayed off, you know, I didn't just rebound. I felt like, wow, you know, if this worked for me, and I'm seeing the stories of it working for other people, I wanted to share that message.
Now, did you find that you had any weight struggles as a child?
I did, you know, I think not uncommonly, like many individuals, I struggled with weight, you know, during childhood, all the way through, you know, adolescence, college, all of that. You know, I'd have periods of time where I was able to drop weight, but it seemed like it would always um, come back. And so that was something, you know, just always kind of having that struggle, if that makes sense, you know, of thinking finally, great, I lost weight, and then to only have it come back 6 months, you know, to a year later, sometimes even shorter than that. Um, and always having people comment over and over again, like, oh, great, look at you, you're losing weight. And then, oh, wait, it stopped again. You know, it's kind of that, you know, yo-yoing. Not only does it take a toll, I think, for people physically, you can struggle with that emotionally, just always feeling like you're under that microscope. So especially, I think for me, intermittent fasting has kind of just taken all of that away, and it's really a great feeling.
Now, what about when you were in medical school? Did the pressures of those exams make you eat more? And when did you graduate medical school? And when did you have that space in your new moment where you said, "Okay, it's time to do intermittent fasting"?
Yeah, so I graduated medical school in 2008, and honestly, I didn't stumble upon intermittent fasting until 2017. So it was a long time between that. During medical school, you know, it was a lot about my meal timing, at least, you know, looking back retrospectively with the intermittent fasting, because you stay up late to study. So, you know, if I'm up studying in medical school till, you know, 10, 11 a.m. at night, or p.m., excuse me, at night, and then I'm eating or snacking, I wasn't really giving myself gut rest. Also, outside of the meal timing, which you alluded to, stress. So, stress in general, I really think we downplay how proper sleep and proper stress management are also very central to weight loss and health, aside from the calories that you're consuming. And so, you know, you kind of just have that perfect storm. It's, you know, you're stressed out, you're not sleeping as much as you should, and then you're eating, you know, at all different sorts of hours of the day. And it's, you know, no wonder why it was difficult for me to lose weight. And that schedule, even though I may not have had to stay up as late once I got through residency and all of that, still, you know, taking proper time out for you, right? Having time for stress relief, whether that's in the form of physical activity, meditation, you know, really prioritizing you. We tend to prioritize all the other things we have to do rather than focusing on ourselves. And so not only did I do intermittent fasting, but I also tried to look at other stressors in my life as well.
Now, you didn't go to school for intermittent fasting, did you?
No, correct. I did not. I did not learn about that until much, much later. Intermittent fasting, found out through a book. It's called The Obesity Code, and I read that book. And that's where it kind of opened my eyes to, maybe there is some validation to this. But what I do in my day in and day out practice now is that I am a high risk obstetrician. So I work with pregnant women who are at high risk for complications, whether that's because the baby has a problem or the mom has a problem. But as an aside to that, I also work with women wishing to become pregnant and helping them improve their health prior to pregnancy, because we know if we can get mom in a healthier state prior to pregnancy, that's going to help decrease her risk and baby's risk of medical complications.
What are some of the tips that you give to those women? Obviously, you include intermittent fasting in some way, right?
Yes, yes. So we focus on intermittent fasting a lot prior to pregnancy as we're helping people to become healthy. But then also some of the things I mentioned in terms of, trying to look at stress reduction, looking at the quality of food you put into your body. Food is medicine. And so you want to look at actually what's going on to your plate and making sure that it is a whole food based approach. The reason that I really do like to focus on some of the other aspects aside from intermittent fasting, as we're trying to, treat the person as a whole, is that during pregnancy, we don't recommend intermittent fasting on a scheduled regimen. So that's not to say that you have to eat constantly around the clock because you're pregnant. You can still stop eating a couple hours before bedtime when you're pregnant, and that will help just decrease reflux in general. So that's not a bad habit to do, but you're not going to be able to, fast for 16, 18, 20 hours and on a schedule during pregnancy, because at this time you're focusing on creating and growing a healthy, happy human life. But you can keep yourself healthy during pregnancy with really focusing on food quality, trying to make sure that you can get as much sleep as possible, especially before that third trimester hits, and looking at keeping yourself physically active, which will help make for an easier labor.
Now, that's an interesting pathway because you used to help people before you went down the path of intermittent fasting. You used to help people who were pregnant, right? You used to work at.
Yes, correct. So I also am a perinatologist, or also known as a high risk obstetrician. And so my original kind of profession is to help women who have a high risk pregnancy. So whether the mom is high risk because she herself has medical conditions, or if she's high risk because the baby or the pregnancy she's carrying has a high risk condition. And that's what I do day in and day out. But I also thought, wouldn't it be amazing to help women become healthier prior to conception and prior to pregnancy? Because we know that entering pregnancy in poor health just places you at increased risk of having pregnancy related complications. So if we could really help address health prior to pregnancy, then we can really affect not only the outcome for mom, but the outcome for baby as well.
What an amazing phenomenon. And it makes total sense. It's like common sense, but at the end of the day, not many people are really looking at the pathway before if they just really start their road either during or after they have their baby. So I can't wait to hear about intermittent fasting. What is it?
So intermittent fasting, you'll probably hear a lot of terms out there, but the simplest way that I like to put it for people is to think of it of gut rest. You're giving your gut a break. You're giving your body a break from processing food. And, a lot of people say, well, why do we even need a break? But traditionally, or what we think anyway, is prior to kind of industrialization, right? We really functioned according to the sun. And, some people say, oh, that sounds hokey, but think about it, right? Before you had electricity and all of these different things, life kind of turned in for the night when the sun went down. And consequently, life began again the next day when the sun came up. So you really wouldn't find people eating much after dark, staying up late after dark, because there really wasn't anything to do but go to sleep. Now we can stay up as long as we want. We have access to food, most people, right, as often as we want. And so we're really not giving our gut a chance and our body a chance to rest. And so that is some of the premise behind intermittent fasting. A great quote that I've heard some people say is, it's not necessarily about depriving yourself from food. You still eat food. You're just changing the frequency in what you're doing.
So how does it work?
So how it works is that what we believe is when we all have insulin. So an insulin in itself is not necessarily a bad thing. We know there's certain medical conditions like type 1 diabetes where if you don't have enough insulin, then that can cause disease. But for a lot of us, because we eat so frequently and the types of food that we eat, we're constantly spiking our insulin, which is telling our body to store energy and storing energy in the form of fat. And so when you give yourself a break from eating, gradually those insulin levels decrease, which helps you to mobilize stored fat from the liver, also mobilizing stored fat from wherever else you have it stored, allowing you to become more of a fat burner and then decreasing weight.
So if somebody wants to begin the process of intermittent fasting, how do they schedule this out? Does that mean that you give your gut an hour rest, 2-hour rest? How much time?
So a lot of it depends on where are you starting from, because you want to always start off with things that are realistic for you, and then you want to build upon that. So there are some people who are just such frequent snackers that even the thought of going 5 hours between meals seems daunting. But what I usually have people start with are just try 12 hours, because a lot of people have never even done that before. So when I say 12 hours, let the clock work with you. Don't fight the clock, let it work with you. And so fasting occurs when you're sleeping. So a nice thing for people just to try or get into the habit of is, look at what your usual bedtime is and stop eating 2 to 3 hours before you go to bed. And then when you wake up in the morning, don't just roll out of bed and immediately head to the fridge. Give yourself a little bit of time. Get up, brush your teeth, maybe do a quick workout if you feel like it. Read a book, whatever, you want to do, and put at least an hour or two after waking between your first meal. And try that for a little bit. And then you can build upon that by either ending your eating window earlier. So instead of eating, 2 to 3 hours before bed, maybe wait and do that for 5 hours prior to bed. Or if you don't want to move your end time, you can move your start time. So rather than, just delaying your meal by 2 hours in the morning when you first wake up, slowly push that back and just really look at your schedule.
That's amazing, Dr. Cecily. Thank you for sharing that. Now, quick question. Does this have to be a consistent everyday journey where you're intermittent fasting every single day? Does it start off a couple times a week? Do you build? How does one begin?
I think if you've never done it before, trying it 3 to 4 times a week to start is a good way to get used to it, especially when you're trying to wrap your mindset around, a new lifestyle, right? Eventually over time, because again, you have different periods of intermittent fasting. And so you may find that you naturally fall into a regimen during your busy days where you may fast longer. And then on the weekends, for example, you may do 12 hours or something shorter rather than 16 hours. So you definitely don't have to do a specific regimen every day, but I find most people over time just feel better when they practice some form of gut rest. And that can be, like I said earlier, just in varying lengths, depending on what your schedule looks like at that time.
Some people actually take a very aggressive intermittent fasting approach. And could we talk a little bit about that and what that looks like when you're aggressively tackling it?
Yes, so there are several different ways. What you all may hear most commonly in the media right now will be kind of like your 16-8 regimens. When people say that, they mean 16 hours of fasting, and then you have an 8-hour eating window. Another thing that's really popular right now is OMAD, and that stands for 1 meal a day. OMAD. And that a lot of people like that as well. I will say, if you're just starting out and you're used to eating several times a day, mentally that can be kind of tough to go from many frequent meals to only eating one in a day. And there's some intricacies behind that, because if you're only having 1 meal a day, that needs to be a really good meal. I mean, like very nutrient dense and really fulfilling. You really shouldn't do 1 meal a day and your 1 meal a day is a salad with nothing on it. Like that's not going to be sustainable long term. So those are different ways. And then you can do varying fasting lengths in between.
That's amazing. And what about, and it's interesting that you said, it depends on what you put in during the meal times. What about those folks that are really taking the approach of intermittent fasting works? It's going to give me gut health. It's going to help, my gut relax. And then they eat like Twinkies and Burger King, or I mean, whatever fast food, not Burger King, but whatever. Does that kind of, get in the way of what they're really trying to do with their goal?
So there's a couple different camps. I really do believe in the concept that food is medicine. And I also recognize, and I want to meet people where they are. And whenever you're doing a health journey, your health journey as it starts today is going to look, and honestly should look, differently 2, 3, 4 years down the line, because we're learning and constantly, reassessing and seeing where we need to go. So I think when you first start out, you can you pick one or the other, right? When you first start out, not to overwhelm yourself. And so you can start with getting the fasting down and getting into a schedule. But then I highly encourage people, once you have gotten kind of the routine down that you think is most doable, then you really need to go back and look at what's on your plate, and really trying to consume whole foods, real foods, and really trying to decrease the amount of processed foods that you have on a day-to-day basis.
Yeah, I mean, I don't think there's anything wrong with eating Burger King. That you could have salad there too. I mean, you could make some good choices regardless where you find that food, but definitely making those good choices makes a difference for sure. But with the fasting, isn't a person like starving, and don't they start eating everything in their refrigerator when they wake up? Or what is a good plan on making sure that doesn't happen?
Right. And that's why I think, again, it's important to kind of tackle things stepwise, because when people try to change too much at once, then that's where I notice more, where people are tempted to then go find just everything that they feel like they've been depriving themselves of. So for example, if you start off with 12 hours, then you really, I mean, most people aren't going to feel that overwhelming urge to just eat everything. And then gradually getting your body used to going further lengths of time. The other thing you can do is, it's not that you have to deprive yourself indefinitely whenever you make a healthy, lifestyle change. You will still have those periods of time. I still have those periods of time. For my birthday, my family made me a homemade chocolate cheesecake. And I ate it. It was great. It was amazing. But, you know, I don't necessarily have dessert every day. I don't have dessert every week, you know, and so it's really about balancing those times, if you will, of the feast, because we do feast at times, and there's nothing wrong with that. But you don't necessarily need to feast like that every day, if that makes sense.
Now, do you recommend a higher protein intake during this time frame when you're doing this intermittent fasting, or what are the recommendations to really successfully leap forward in this journey?
So I think that's the great thing about intermittent fasting. Honestly, it works pretty much with whatever kind of dietary camp or lifestyle, you know, that you're in. So if you are more plant-based, you can still do intermittent fasting. If you are keto, you can still do intermittent fasting. If you're paleo, if you're a mix of all of those things in between, if you're picking a whole foods lifestyle, intermittent fasting works really well with any of that. Now, sometimes people will notice, you know, to help with hunger or to feel more satiated, that protein in general can help with that. But you can do that whether it's animal protein or plant-based protein, can definitely help with that. The other reason why I like people to decrease their processed food intake is because processed foods in itself can start to stimulate that hunger and that feeling that you need something to eat. Also, looking at your beverages, if you're drinking a lot of sugar sweetened beverages, whether it says diet or not, those are good things to start eliminating from your diet, because those also set off those cravings, you know, of you wanting something else to eat. So kind of looking at that from a dietary standpoint helps.
Amazing. And what are your thoughts on carbohydrate intake?
So carbs in general, I think you have to look at what are the carbs that you're eating, because all carbs aren't created equal. And that's why calorie counting in general doesn't necessarily lead, for most people anyway, to sustain weight loss, because you're treating the 100 calories that you just had from broccoli as if it's the same as 100 calories from a donut, and the two are not equal. In general, though, when we tell people, or at least when I tell people to lower their carbohydrate intake, they naturally lower that processed carbohydrate. And so that is really helping when we talk about carbohydrate restriction. But it doesn't have to be, you know, necessarily anything super low. You know, I think I read somewhere once that the average American may take in anywhere from 250 to 300 grams of carbs a day. And so you certainly don't need that, especially since that is going to be in the form of processed foods. So if you really do eat a lot of processed carbohydrates, a nice starting point if you're combining intermittent fasting is even just to reduce that to 150 grams a day. And make sure you're prioritizing getting carbohydrates from real foods.
And for the folks that are looking to jump into intermittent fasting, what's your suggestion for a real leap forward to get into it right away? And also, are there concerns or restrictions for those folks who have insulin concerns or diabetic concerns?
So if people wanted to just jump right into it, you could, you know, say start tomorrow. And when you're starting tomorrow, try, instead of, if you're a breakfast person and you usually eat around 7 a.m., see if you can push that back until 10 a.m. So you can still have water. And if you are a coffee person or a tea person, you can still drink those, but really you don't want to have any additives in that. And so a lot of people find drinking black coffee difficult. So I would say just push back that first cup of coffee then until 10 a.m. And try it and just see how that does. And if that went well, you know, make a goal and say for the next week, you're going to try to do that 3 or 4 times. And then the next week, push it back more. You don't necessarily want to start intermittent fasting while there's a big holiday coming up, right? Like, because if it's a big holiday and you're with family, and you're gathering, you may not want to be the only person at your family gathering that's not partaking in something with everyone. So also make sure that the timing of when you're going to try to start really sets you up for success.
And the concern for folks who have perhaps a medical condition or insulin issues or diabetes, are they any tips for them to start?
Yes, definitely. So if you have medical conditions, especially if you take medications, you want to make sure to consult with your healthcare professional, because medication adjustments are often needed depending on what you're taking medicines for while you're intermittent fasting. But there are some great success stories of people reversing their type 2 diabetes with intermittent fasting, coming off medication, having metabolic syndrome reversed. And so you definitely can do it. You just really have to make sure that your healthcare provider is on board. To give you an example, if you're a diabetic and you're on insulin, we all know that you shouldn't take insulin if you're not eating, right? Because that can cause low blood sugar. But how that medication is then adjusted, you would need to make sure that it's adjusted appropriately with your care provider.
That's great. And the results and the time span, can we talk a little bit about that? What should be expected as far as when you start, when people should feel like they're successfully plowing forward with the intermittent fasting?
Yes. So I think it's important for people to realize that intermittent fasting is not necessarily a magic pill where you'll do it a couple times and then you lose 100 pounds. And then it just stays off forever. So intermittent fasting should really be viewed as a lifestyle commitment, a way that you are going to pretty much live your life, from here on out. For me personally, when I first started intermittent fasting, I lost over 50 pounds, and I did that in a span of a year and a half. So the weight came off, but it wasn't instantaneous. I usually tell people in the first couple weeks, you may or may not notice any significant weight loss changes. You may only notice a pound or two. And that's why it's important to also keep track of your progress beyond the scale. So doing things like measuring your waist circumference, taking a thigh circumference, an arm circumference, because you will also notice that a lot of people report that they're losing inches, but that the scale hasn't moved. But something is going on if you're losing inches. It's just your body kind of redistributing that fat and then also building more lean body mass.
Amazing. So there's a lot of benefits to intermittent fasting, not just losing weight. Could we chat about a little bit of the benefits?
Yes. And honestly, I really think people should look at intermittent fasting as a health tool for general wellness with a side effect of weight loss. So intermittent fasting has, proposed a lot of health benefits. There recently were some publications that have reviewed some of the trials that we have in humans. And so showing anything from increased metabolic health, meaning if you have like diabetes or cardiovascular disease or high blood pressure or things like that, showing that these markers have improved in people as well. We're now starting to study it more in the realm of could it be useful potentially for cancer prevention, for brain health in terms of looking at it and preventing dementia. So there are a lot of other reasons to do intermittent fasting, even if you are of quote unquote normal weight. There are many reasons to intermittent fast.
Such great news to hear about all this dieting. I can't wait to start my own journey with trying out the intermittent fasting. But for those folks out there that want to begin, is there an age limitation? Is there a weight limitation? Or could anyone at any age and at any weight, is it ever too late to start or too early to start?
So no, I don't think it's ever too late to start. At least we don't have any information to suggest that if you're 70 plus, I'll just throw that out there that you shouldn't do intermittent fasting. We don't have that data to say that. Now, too early to start, that's an interesting topic because we we really don't recommend that you have children participate in intermittent fasting, at least in the way how you and I may do it, right? So, if we're trying our intermittent fasting and we're saying, okay, now I'm on a 16-8 schedule, blah, blah, blah. We're not suggesting you put children on a schedule like that. However, I do think it's helpful to let children learn their natural hunger cues because I think we have a tendency to look at the clock and then say, okay, it's time to eat. But you have to ask yourself, well, why is it time to eat? Are you hungry? Because if you're not hungry, you shouldn't eat. And I think that's the biggest premise amongst any of this. If you have children who are outside in the backyard playing, having fun, you know, outside for hours, why would you interrupt that play, maybe other than to make sure that they're hydrated if it's a hot summer day, to tell them to come in and eat? Does that make sense? So it's really about just letting people eat when they're hungry. But no, I would never say, and I don't think anyone would say, nor is it recommended, that you tell a child, well, you can't eat yet because you're fasting, right? Like that's just not a concept that we want to introduce to children. But I also tell parents, wait and just even experiment with your child coming up to you rather than you just saying, okay, breakfast is ready, or okay, dinner's ready. I have it all laid out on the table, everyone. You could still prepare it. And so when they come to you and actually say, hey, mom or dad, I'm hungry, then you can give them the meal rather than putting them on a schedule.
That's a really great tip. And what about the folks that have like a lot of weight to lose? Do they feel like this could be a path to success for them too? Or do you recommend that they start elsewhere before they dip their toe into intermittent fasting?
No, I think honestly, the encouraging thing I think about intermittent fasting is that if you have significant weight to lose, you usually start to see pretty good weight loss with intermittent fasting. Now, like with anything else, people will hit a plateau and you have to kind of work through that because the scale doesn't always move down, right? It's more like a zigzag line when we're talking about weight loss. But no, I've seen people lose 100+ pounds with intermittent fasting. So don't be discouraged if you have a significant amount of weight to lose. Be empowered that this can be a tool that can help you do that.
And what happens when you're just so hungry and you're fasting in those hours? What do? Do you just drink water, hot water, or do you just break down and say, ah, today's one of those days where I'm just going to give myself a little leeway and eat more?
Both, right? Because we're human, and some days you may be hungrier and you may break your fast early. But the first thing I suggest is really trying to see, are you hungry, or is it just that your hunger cues are off kilter? So, because, right, we eat for a lot of different reasons other than hunger. We eat because we're stressed. We eat because we're tired. We eat because we're bored. Um, right? There's so many other reasons that we eat than just for nourishment. So the first thing I always suggest is when you get that first hunger pain, or when you think you're hungry, get up and go do something. Like just something like, go be busy, figure out something to do to take your mind off of it. And a lot of times what you'll notice is that you're not hungry anymore once you've occupied your mind with something to do. But on the flip side, if you come back and you have done all the busy work that you can think of and you're like, yeah, I'm still hungry, that might be a day where you end your fast earlier. And then, you know what, maybe close your eating window earlier that night then. So, say you were going to do 16 hours or you set out to do 16 hours, but you broke your fast at 14 hours. Well, then maybe that evening, just push up your evening meal earlier. So there's lots of ways. That's why I tell people, still think of fasting as flexible because you can make up the hours on different days.
So, what are the tips of identifying true hunger? How do you know when you're really, truly hungry?
So sometimes you really don't realize it until after the fact, where you went ahead and ate, and then you're like, actually, that didn't satisfy what I was feeling. And it really wasn't hunger. So, again, I think one, looking at your stressors. Do you notice you are hungrier when you tend to be more stressed out? Are you hungrier the following day after a poor night of sleep? Are you hungrier when it's not a busy day at work versus when it is a busy day at work? And so some of those things help you to kind of start to retrain your mind so that you realize, actually, I wasn't hungry, because when I addressed X, Y, and Z, I found out that I wasn't as hungry the following days afterwards.
It's incredible tips. I'm really grateful to have you on today. For the pregnant mamas, for the ones that are, are out there and they're planning to have, they're actually pregnant and they're having their baby soon. What tips could we give them? Because they feel the baby's hunger, right? They get hungry every couple of hours. What could they do?
Yes. So the important thing is that kind of how I mentioned with children, that we're not going to put a child on a schedule and tell them you must fast for 16 hours. We don't do that during pregnancy either. However, you don't have to, again, eat on a clock per se just because you're pregnant. So give you a perfect example. A lot of women during pregnancy suffer from acid reflux or indigestion, because the hormones during pregnancy cause the esophagus. There's like a sphincter there, kind of helps keep it closed, and that loosens during pregnancy due to the pregnancy hormones. So one of the things we tell people before prescribing medication is, we're like, well, don't eat, a couple hours before bedtime. Why? Because you're going to lay down, and then when you lay down, right, that food's going to come back up. So if you've spaced out the period of time between laying down and eating, right, then that helps. Well, that's a form of gut rest, right? And so we tell pregnant patients to do it in different situations. But again, we're not saying, you need to intermittent fast, but, there's no reason that if you're not hungry after 7 or 8 p.m. during pregnancy, that you need to eat all the way up until bedtime just because you're pregnant.
Now, we've touched upon the women who are looking to have babies, the pregnant women. We chatted a little bit about, just the everyday human being who's trying to get into a rhythm of starting intermittent fasting. We also talked about the importance of understanding the whole situation, the great picture of what's causing the hunger, what's real hunger pain, what versus, an emotional desire to eat or boredom, etc. We're here with Dr. Cecily Ann. This is Motivations TV. We're helping you guys live your best life. I'm Janet Miranda. If you guys find this message was helpful and you think that this can help one other person, please do share with at least one other person so that we can continue to grow our community and live our best life. If you'd like more information on Dr. Cecily N, you can find it on our website at www.motivationstv.com. You can also find us on Facebook, Instagram, Twitter. If you haven't subscribed to our YouTube channel, go ahead and do that now. Click the notification bell, drop a comment, and let us know what other topics you want to hear about. And we will do our best to find the experts to chat about it, just like we found Dr. Cecily Ann. I'm Janet Miranda. This is Motivations TV. Stay tuned for more.